Yeah, I'm in a Zoom window where I've tried different views I can see the participants, what have you, but I don't have my standard kind of a dashboard where I can,
Oh, okay. Well, let me make you
whoop,
co-host,
right.
and that might help
Now, I
the
think it has
interface.
to do with um, I'm looking at a Zoom frame within a browser. I'm using an Apple, which I normally don't
Sure,
use, but I've got to get to the Zoom application, which
sure, sure.
I think would bring it up. Okay, this looks a little better.
Peter, you want some more time?
Um, uh,
Whatever you need. That's fine.
yeah,
We're easy.
looks like I just can't work through it. I think I'm going to need to have you share it, and I'll just put
Sure.
next slide, next slide, next slide.
Yeah, happy to. Is that the guide you sent?
Yeah,
Yeah, happy to. Yeah, I'll put that up when the time
thank
comes.
you.
Yeah, I'd love to. All right. Should we sally forth?
Yes.
Okay. Very good. Thank you. Welcome, everyone, to Mondays with Michael. So good to be with you today. A warm welcome to all. We are delighted to have you today. We're streaming to several different platforms as usual, and we'd love to hear from you, where you're calling from, any questions you have, things you'd like to share with other folks who are listening. If you're on our watch page at michaelgaeta.com/watch or on our Zoom link, you'll be able to ask questions of myself and our wonderful guest, and we'd love to hear from you. So today is a very special show. Been really looking forward to this, as I'm sure you have as well. We have Dr. Schooler saying, I shared the link for this live stream everywhere. I think that's a common sentiment among our listeners here, given our wonderful guest returning to the show today. So I'm going to introduce him in just a moment. But for those who haven't been with us, I'm sure we have a lot of new listeners today who want to hear our guest. This is an offering of the Gaeta Institute for Holistic Health Education. And our motto here, as is with the Gaeta Clinic for Chinese and Functional Medicine, is nature first, drugs last. And that just means nothing wrong with pharma drugs at all. They're wonderful and necessary at times. And they're simply overused, at least in the US, and there's a natural solution most of the time. And so that gets us to our show today. This is show number 304 for this February 23rd. And we are just delighted, just very honored to have back to the show the wonderful Dr. Peter McCullough, one of my favorite physicians. We're going to be talking today in today's show about the McCullough protocol for base spike detoxification. And if I'm sure there's nobody listening who doesn't know Dr. McCullough. He is so appreciated by so many who are of our listeners here. He is a cardiologist, internist, and epidemiologist. He is the co-author of The Courage to Face COVID-19. He is the founder of the McCullough Foundation and the medical director for the Wellness Company. Our topic today is going to be the McCullough Protocol for base spike detoxification. And you can find him at petermcculloughmd.com and also petermcculloughmd.substack.com, where he publishes extensively on topics related to the COVID injections, medical freedom, and a range of other topics. So please, and also, if you haven't yet, please go to his show site. It's Focal Points, Courageous Discourse, And I just had the honor to recently appear for the fourth time on Dr. McCullough's podcast. We had a wonderful conversation focusing on cancer, and I thought that was a very productive conversation. Dr. McCullough is not just a cardiologist, he's also an internist who sees patients with a range of issues. So with that, and here is, I had the great honor of welcoming Dr. McCullough to my cardiovascular seminar in 2024 in Dallas, where he is located and practices. And as I shared with a couple of you, it was a little nerve-wracking doing a presentation presenting some basic concepts of cardiology with one of the greatest cardiologists ever sitting in the back of the room. But I managed to get through it, and we had a wonderful conversation, and he shared a lot of insights with us at that event. And as always, if you're on our watch page or on our Zoom chat, we really welcome your questions. Dr. McCullough is just someone we're very honored to have with us. So let's give a warm Mondays with Michael welcome to Dr. Peter McCullough. You can type on whatever platform you're on, and just give Dr. McCullough a warm welcome. Peter, so good to see you.
Well, great to see you, and thanks to each and every one of you for joining. Dr. Gaeta, I think, is held, at least in my view, as one of the greatest naturopathic medicine doctors that we have in the United States today. And I've had patients visit him at his institute in Boulder and so satisfied with his solutions. He mentioned this mantra of kind of natural first and drugs last. I think there's no better problem than the spike protein to apply those principles. Because I can tell you, I'm a drug prescribing doctor. And over the last 6 years, I have tried every drug in the world against this spike protein, the SARS-CoV-2 spike protein, without success, Michael.
Wow.
And in fact, the successes have really come through natural products, which is, in many ways, it's an interesting observation. The spike protein, which is the spine on the surface of the virus, this is what I'm talking about here. It's the little spicule on the surface of the SARS-CoV-2 virus. It's the synthetic, artificial part of the virus. It's not a naturally occurring protein. It's a protein that was harvested off a bat coronavirus. It is about 1,200 amino acids in length. It has about a dozen glycosylated side chains, about 3,400 base pairs code for it. But it's been specifically engineered in the Wuhan Institute of Virology to dock with human ACE2 or angiotensin converting enzyme 2 receptors, to invade the human respiratory epithelial cells, and then actually invade the body.
Right.
I think what many didn't expect is that this protein would not be amenable to typical human proteases. The human body has many natural enzymes to just break down proteins. We get influenza, we have a variety of neuraminidase and hemagglutinases. It breaks it down. We get other things in our body. You get staphylococcal toxin, and we break it down. But the spike protein we cannot break down with our own apparatus. And so through the early efforts of the Biden administration, the long COVID research program, which was $1 billion spent, the approach was to try to get the body to, in a sense, if we could just manage inflammation from the spike protein, things would get better. Or if we could just manage symptoms from neuropathic symptoms, things would get better. The problem with the Biden administration program is not a single project addressed the spike protein. Not a single research project measured the spike protein. And now we're all coming to realize that the spike protein is the cause of long COVID syndrome. It is the cause of the vaccine injury syndromes. It is found in the human heart, in the brain. It's at the site of blood vessel ruptures and stroke. It's in blood clots causing the blood clotting. And patients are getting enormously frustrated because they're seeing doctors. They know the spike protein is the cause of the problem, and the doctors are baffled. And a typical doctor like me, an allopathic doctor, would try drugs first. And of course, I've done that as well. And it doesn't solve the problem. Even blood thinners for blood clots don't, in many cases, solve the problem. The spike protein is still causing this persistent rubberized blood clot, this amyloid type of fibril dense blood clot. And so we need natural products to dissolve it. So if you can bring up the guide, and
yeah, happy to.
Right now I can only see you in a limited screen. I have really backed myself into some
no problem at
problem in Zoom.
No
I'm in my media room in my office. So my clinical exam room is right across the hall here. I don't have Nick Hulsher here, my trusty assistant. He would help me get out of this.
He's doing a great job, by the way. I mean, it's just amazing what he's putting out, and like you, he's really getting the word out broadly and about the dangers of these injections. So I just appreciate the work two of you are doing.
He gives us great hope for, Nick's not even 30 years old yet. So
I know.
Nick gives us great hope for the next generation. Okay, so do you have the spike protein guide up?
I do.
Boy, I sure wish I could see it. But what we did at the Wellness Company, and as Dr. Gaeta pointed out, I am the Chief Scientific Officer of the Wellness Company and one of the founders of the company since 2022.
Yes.
That we've created a guide, a layperson's guide to describe the spike protein. I believe the guide's about 6 pages in length, and you can hand it out to patients. It's scientifically referenced, everything in there. We have the backing for, so people can understand that the spike protein retained in the human body is fundamentally the cause of these pandemic syndromes. And if you get to, I believe, about page 4 on the guide, if you can bring it up.
Yeah. Are you able to see the viewer screen?
I can't see it.
Oh, okay. No
right
problem.
Right now, I'm so limited in what I can see.
Oh, no problem at all. I got you covered.
Yeah, and so if you can.
And Peter, I just wanted to back up just for a sec. Could you just explain a bit, because I know so much of what you've published in your career has been around the renal system and the kidneys. Could you just explain for our listeners who are not as aware the significance of the ACE2 receptor for this entity?
Well, sure. ACE2 receptors, now I can see the guide. I kept clicking buttons and I got there. The spike protein, it folds, and it does lock into the ACE2 receptor. The ACE2 receptor is on virtually every cell in the human body. It's on immune cells, and it is a receptor that is worked to essentially catabolize angiotensin converting enzyme. And what the ingenuity was in the Wuhan Institute of Virology is to harness this receptor as an entry point for the spike protein. So the spike protein comes in contact with the receptor, and the little outer part is able to get in. The inner part folds, the S2 part, and that's sacrificed. That actually is catabolized by the ACE2 receptor. And then the virus just, boom, goes right into the human cell. So it's ACE2 receptors, because they're so catabolically active, it turns out that people with more numerous receptors did better than those with fewer receptors, because they can chew up the SARS-CoV. So the case in point is children. Children's lungs are loaded with ACE2 receptors, so they cleared out the spike protein easily. They didn't get COVID pneumonia. So when you get older, you have fewer ACE2 receptors, and so there's less catabolism. And so, and there's always enough receptors for the virus to invade and cause problems. But they're all in the human body, all around the human body. They are an important entry point. But when you get the virus, and 90% of us have gotten the virus, we have the little tip. The S2 gets stuck in our human body. It's been found in what's called exosomes, or little phospholipid packets, or within white blood cells in the human body for years after the infection. Years. Now, when you take a vaccine, Pfizer, Moderna, it's the genetic code for the full-length spike protein, And that genetic code comes into the body. It bypasses any ACE2 receptor, obviously, and it just starts producing spike protein. The spike protein is held open in the pre-fusion conformation. So it doesn't, the vaccine spike protein does not fuse with the ACE2 receptor. There's no catabolism there. And so it quickly trimerizes, it folds into little bundles of 3, and that held open full-length spike protein begins to circulate in the human body and deposit in tissues and cause damage.
Right.
This is very important. So all these papers you read about the vaccine and the ACE2 receptor are irrelevant. That's just people not conceiving what's going on. We've, in patients now, measured the spike protein, the full vaccine spike protein in the human body 3.6 years after taking the shots in the bloodstream.
So does it seem that this is going to be sort of permanent, folks who have received the injection who don't take other measures?
We don't know.
That's a long time.
But I can tell you it's a long time, and I think it's evidence that the human body alone can't break it down. Now, fortunately, in this individual, once we started the natural enzymes to start breaking it down, sure enough, he cleared that spike protein out of the bloodstream, which is...
And are there methods reliably of measuring either the protein or the antibodies or the bioburden or anything related to it? Do you have any good metric?
Right now we have antibodies directed against the spike protein as an indirect measure.
Okay.
And then very shortly we should be able to directly measure spike protein. So matter of fact, our office has a call today regarding, finally getting that up and running, which will be huge. And I think it's going to be very alarming for people to see that they took a vaccine and the spike protein is still in their body years later.
Wow.
But bring back up, now I can see things, Michael. Bring up the...
Happy to. And your foundation has published extensively on damage from the injections and from the spike protein. Cancer, cardiovascular disease, I mean, it's a pretty enormous list. So just for our clarity for our listeners, all of this catastrophe that we're seeing, cancer, all-cause mortality, the long list, is due to the persistent spike protein.
There's could be some of this that's directly due to the messenger RNA of Pfizer and Moderna alone, but most of it, Michael, we think is due to the spike protein.
Wow.
And virtually everything we're seeing with the vaccine, you can actually get with the infection. It's just that there's a lower risk because, again, it's the spike protein.
Right.
So, for instance, one syndrome that I think is pretty similar in risk is blood clots. I see blood clots every day in patients. I had 2 or 3 today. And I think the risk is the same if you've had the infection or the vaccine or both.
Wow.
Now, myocarditis is much greater with the vaccine because it's just a much greater loading of the spike protein. And yet the American College of Cardiology has just the opposite idea, that there's more of a risk with the infection than the vaccine. And 90% of us have had the vaccine. Right. And it's only the serious and fatal cases of myocarditis that occur with the vaccine as opposed to the infection. So just to clarify, 90% of us have had the infection, and 81% of us have had at least 1 dose of the vaccine. 70% of us have had 2 doses of the vaccine.
Yes.
Okay, so we're back on the guide, and it has 5 chapters and conclusions. And if you can go just to the next page of the guide.
Sure.
And we put this together and curated it to describe the spike protein and tell you the tissues where it's found, including the lungs, the heart, the kidneys, the gastrointestinal tract, the lining of blood vessels. We think that's very important. I mean, this is all in the peer-reviewed literature. Why certain people are affected more than others? Well, older, overall health status that's poor, other environmental exposures. This is important. We seem to find patients who've been exposed to mold toxins, tick-borne diseases, heavy metals. They seem to be actually more affected by the spike protein. And I think a lot of the practitioners listening will say, gosh, I have patients who seem to have multiple of these, in a sense, kind of environmental exposure related illnesses.
And Peter, what's your take on this shedding idea?
You know, Helene Benoon at INSERM in France, or formerly at INSERM, has published the most on this. I think shedding has been reliably described in menstruating women when one woman comes in contact, let's say a vaccinated woman comes in contact with an unvaccinated woman, changing the periodicity of the menstrual cycle. That's been demonstrated. There's not a single case, a confirmed case of transference of messenger RNA. That has not been shown.
Okay.
I think the shedding that occurs, based on what's been published, can certainly make somebody feel uncomfortable or ill around somebody else who's shedding spike protein. The spike protein, by the way, does come out in these exosomes in exhaled breath, sweat, and other human secretions.
Yep.
But I don't think it causes bona fide illness. I haven't seen this kind of
okay.
Yeah, you see what I mean? So people can feel transiently ill.
Yep.
That's the extent. Now, I got a question today about blood transfusion.
Yes.
Remember, blood only stays on the shelf 42 days.
Right.
So, back when everyone was taking the vaccine in 2021, myself and Dr. Cole and others wrote the American College of Blood Banking. We were concerned about this, and they responded back months later, indicating they don't have a concern. But, here we are today. In reality, probably fewer than 1% of people taking a COVID vaccine, and fewer than them actually donating blood.
Right.
So, I really don't think we have concerns right now. And remember, blood transfusions are not lightly administered. So if someone really needs a blood transfusion, I think the benefits would outweigh the risks.
Okay. It's for surgery or trauma.
Yeah. There's never been a bona fide case of transference.
Okay.
So if you can look at this spike protein distribution in body systems in that lower right, and we'll challenge you in terms of your ability to expand that.
Oh, no problem.
Compartmental diagram.
Yep.
You can see this concept here that it has been shown the spike protein is everywhere in the body. 320 peer-reviewed studies now demonstrating that it's in blood vessels, the lungs, kidneys, brain, heart, in the peripheral tissues. And very importantly, it is related to what's called microclotting. The spike protein links up other red blood cells in a formation we see under the microscope called rouleau formation.
Yes.
And multiple studies show micro blood clots traveling in the blood vessels behind the retina, for instance. They almost certainly are the nidus for stroke.
Yep.
And in an important study where patients who had post-exertional muscle fatigue, they underwent calf biopsies, and they found, again, this spike protein rouleau formation in the capillaries of blood vessels. So this brings up this idea of, getting rid of the spike protein in the human body, but also encouraging exercise and blood flow. My most severe long COVID and vaccine injury syndrome patients are completely sedentary. And I think exercise, particularly in these syndromes, is therapeutic, just because it's augmenting blood flow through these capillaries.
So, Peter, is it that the endothelial cells are expressing spike, or are they getting damaged by circulating spike?
Both.
Oh, okay.
Both. In the vaccinated, don't forget, the messenger RNA is also equally long-lasting. In this case report we just published, Pfizer was circulating in the bloodstream 3.6 years later. The synthetic messenger RNA of Pfizer. It must be passed from cell to cell to cell. Okay, let's move on to the next page.
Sure.
And make it smaller again. So this kind of shows a total body distribution of where we have evidence. And some people may ask, well, why does one person have a neuropathy, another person have myocarditis, another person have, and it probably actually has to do with the predominant distribution. Blood distribution in the body is not equal, And each person, it's different. They may have taken the shot and gone exercising. Some may have gone swimming. Some have felt sick and just go home and lay down.
Yes.
Each person's different. Marc Giaudot from France has been publishing on this idea of what's called the bolus theory. That is, the vaccine centers were told to just plunge the needle in the deltoid muscle, inject, and not to aspirate back. And in these vaccine centers in 2021, many were not medical personnel. And I can tell you, as a doctor giving injections, I always aspirate back to make sure I'm not in a venule or a capillary.
And could you just explain that a little more for folks who are not practitioners, Peter, just what that means?
There are blood vessels in the muscle where the vaccine was given. And if the needle happened to go right into a blood vessel, then that meant when the plunger goes down, Pfizer, Moderna, or Janssen, or Novavax would have been immediately distributed through the circulation. If it hit muscle without any appreciable entry into a larger blood vessel, it just would have stayed in the muscle longer. And so if it stays in the muscle longer, it may get a milder, more even distribution in the human body.
Interesting. Okay.
But if it hit a venule and it was, let's say, half a cc that got mainstream, then it's just a matter of where did it circulate in that first pass through the human body. So
Yes.
I had one patient who traveled to see me from Washington State, a wonderful man who took the vaccine because he worked as a defense contractor. And as he took the vaccine, he said he basically could feel warmth going up his neck into his head, like immediately in the first minute after the shot.
Wow.
And I think it went into a venule.
Oh.
And sure enough, about a year or so later, he had a brutal headache and had a rupture of the blood vessel in his brain, blood into his brain, needed neurosurgery. He has a shunt put in. His skull has been opened and closed again.
Wow.
In a paper by Ota and colleagues, they found spike protein right in the blood vessels that have burst in the brain, causing intracranial hemorrhage.
Oh, wow.
It's as plain as that. The spike protein, when it lodges in the blood vessels, Michael, it attracts inflammation. And then over time, that inflammation can be sufficiently destructive
Yes.
to cause the blood vessel to rupture. Just like if there's enough spike protein in the heart, there can be enough inflammation to cause chest pain or cause a cardiac arrhythmia. If there's a ton of inflammation and the right trigger of adrenaline and noradrenaline and dopamine, like let's say during exercise, it can trigger a cardiac arrest. So I think there's this variability in blood distribution. I think Marc Giaudot is onto something.
Yep.
The other thing is in each person,
So, Peter, would you say for folks who are concerned that anything that improves circulation would be beneficial?
Yes.
Okay. All right.
Yes.
Because we have a range of options in the natural field as well to things that optimize or increase circulation, from foods to herbs to PEMF devices that are designed to, or we know, improve microvascular circulation. So that's very helpful.
Yes. Now, I want you to turn your attention to the spike distribution diagram over here for a therapeutic point, and that is, look at the bottom on the right where it says skin and sweat glands.
Yep.
So in the patient we've recently published who's, has Pfizer, Moderna circulating in his blood for 3.5 years, we found it in his skin. We did 2 sets of skin biopsies.
Oh.
And so spike protein and messenger RNA come out in sweat.
Oh, so that's measurable on biopsy?
Yes.
Really?
Yes. It's a technique called reverse qPCR done in skin tissue. Then, of course, standard enzyme-linked immunostaining for the spike. But listen to this. If spike and messenger RNA come out in sweat, and, sweating is a minor detoxifiant system for the body, liver and kidneys being the big ones. But still, if it comes out in sweat, we need to take advantage of this. So, I'm encouraging all my patients suffering with this is to get outside and sweat. Many get infrared saunas at home. These little teepees are very affordable. They go inside and they sweat. There's all different types of devices, Beamer and others. They
Yep.
get people sweating. This is very, very important. If people
Yes.
can sweat, they are going to reliably get spike protein and messenger RNA out of the body. So I would say this, my worst cases are patients that say, Dr. McCullough, I cannot go outside and face the heat. I cannot sweat.
Oh.
I
Huh.
cannot sweat. Oh, yes. And it seems like the more
Huh.
spike protein they have in their body, they feel so uncomfortable getting hot and sweating.
Oh,
And so it's a
okay.
vicious cycle. So
Interesting.
I tell people, listen, you have to start sweating. You've got to get
Yeah.
in a sauna, go outside and sweat. And, after the initial wave of cardiac arrests that we saw in the athletes,
Right.
particularly in Europe, the
Yes.
athletes seemed to be fine. And you know
Really?
why? I think because they sweated this out. They detoxified themselves. Yeah,
Wow.
yeah,
Very interesting.
yeah.
Huh.
So I think sweat is super important,
Okay.
super important.
That's
And
great.
since we've now been able to identify this in the skin, it does go to all the other organs.
Yes.
And it explains why people say, well, gosh, could my new onset Hashimoto's thyroiditis be related to the vaccine? Well, yes,
Right.
it's been found there. How about new onset type 1 diabetes? Yes,
Right.
because it's been found in the pancreas. I mean, all of these syndromes have been described.
So, Peter, Sherry Tenpenny has been talking about mechanisms of vaccine injury for a while. One of them, wanted to get your take on this, was basically cross-reactivity through molecular mimicry. She identified some time ago, or at least located somehow, there are 28 body cell types that were antigenically or epitopically similar enough to the spike protein that spike antibodies would cross-react and target healthy body cells. What's your take on that?
Well, there's a paper from Florida Atlantic University, and I think the first author is Agramati, I believe. But yeah, it's close 28. I think I remember 32 homology with 32 different human proteins
Wow.
contained in the spike protein. So
Oh,
that's the reason why
wow.
there's so much closeness there. The spike protein was being manipulated in a Chinese lab. So of course they were they kept trying to mimic human proteins to get it to, in a sense, be humanized enough to be
Right.
accepted, right?
That will
And
make autoimmune conditions pretty likely.
oh, for sure. So in each and every patient, I check the blood ANA, rheumatoid factor, and anti-citrulated peptide. Today I had a patient who turned ANA positive just from the infection, not the
Really?
vaccine. Yeah, so for
Oh,
was the infection of the vaccine, we're seeing autoimmunity. So the syndromes that have been described after infection or the vaccine include a mixed connective tissue disease. So
right.
not straight up lupus, but mixed connective
Yep.
tissue disease. Another one is rheumatoid arthritis of different, typically not with rheumatoid nodules, but just the arthritic component to it.
Hmm.
Another one is gluten sensitivity, for sure. Another one is just today on Twitter, someone posted it and just been shown before, myasthenia gravis.
No, sure.
Yeah. So one of the features here is that if you don't get rid of the spike protein, you still have all this stimulus for autoimmunity.
Yes.
So in the autoimmune
Yes.
syndromes, my practice pattern is spike detoxification with nattokinase, bromelain, curcumin, and other natural,
Yes.
enzymes and herbs, but also using hydroxychloroquine to shut off that
Oh.
autoimmune process.
Huh. Okay.
And so I had to do that today. She goes, listen, I did the detox doc for 6 months. I'm still not
Right.
better. She's resistant to taking hydroxychloroquine. I said, listen, hydroxychloroquine is a natural product. It's derived from the bark of the cinchona tree.
Yep.
We're just going to need to take it for, I think, 3 months to shut off the autoimmunity, maybe 6. I haven't had
Interesting.
anybody need it long term. Remember, hydroxychloroquine has got concerns regarding ocular toxicity at about 5 years. 5 years. Okay. So,
Oh, continuous use for 5 years.
yeah.
Oh,
Yeah. She was
okay.
told by her doctor, don't take it. You could have eye problems, after a few days. It's like, no, it's
A
5
few
years.
days.
Yeah.
Oh, wow.
Okay. So
Okay.
let's go on. So the spike protein, let's go to the next page, is the,
Sure.
and so this is important. The bottom left is
Yep.
our work on this,
Yeah.
where we think most of the risk of cardiac arrest occurred early on when the spike
Huh.
protein was in the heart. believe it or not, antibodies that were not binding the spike protein
Right.
it could have been a problem. There was a paper by Yonker and colleagues showing
Yes.
that it was published in Circulation, our best cardiology journal. So these poor young boys suffering with myocarditis in Massachusetts General Hospital,
Yes.
they had very high antibodies to the spike protein, but it wasn't binding the spike protein. They were misdirected antibodies, so the spike was allowed to damage the heart. And
Oh,
so the spike protein are like those little dart-like structures in the upper left.
right.
But what we and others have demonstrated is that probably almost everybody has some heart inflammation after the vaccine. They may even have some actually after the infection.
Wow.
But it's
So
the
is
surge.
that an autoimmune mechanism?
No, it's a
Uh,
direct toxicity mechanism.
Oh,
Direct
wow.
toxicity.
Okay.
There's not much
Okay.
autoimmunity here.
Hmm.
But with a surge of adrenaline and inflamed tissue, that's what that little inset shows. It shows
Yes.
these little purple dots. That's inflammation around the cardiomyocytes. And the surge of adrenaline, that's what triggers these cardiac arrests. That's the reason why the majority have occurred on the athletic field,
Yeah.
or they occur between 3 a.m. and 6 a.m. during the normal waking hours of sleep when there's a big surge, a natural surge of adrenaline. So it's either found out dead on the athletic field or jogging, or found dead in bed. And that's been the pattern of young people dying after the vaccine.
Wow.
So, let me just show you. In the bottom,
Please.
the initial rhythm you can see there is ventricular tachycardia. I had a patient last week who took the vaccine. He took 2 Moderna shots and had played baseball, and the kids were responsible for mowing the field afterwards. And so he was weed eating on a baseball field, and he had a cardiac arrest. And it took forever for the boys to get back there and call 911 and all this. And he was kind of intermittently gagging and choking. So he's in and out of consciousness. And that told me he was probably in ventricular tachycardia, not ventricular fibrillation, which is a flat line. Paramedics got there, and it was just late, like half an hour into this whole thing, or 45 minutes. And one shock brought the boy back. So that told me it was ventricular tachycardia. It was a convertible rhythm. And so he was shocked. And the sad part of this is that the doctors never recognized it was a vaccine or spike protein. He's loaded with it. I've checked him. And his defibrillator, he got a subcutaneous ICD. It migrated in his chest. He had to have a repeat surgery, had a pocket formed, fashioned out of it, out of a bovine pericardium. Then that got infected. And then the whole system had to be taken out. So here's this young boy who's 21. He just wanted to play baseball in Louisiana. And his chest looks like there's been a battle axe taken to his left thorax. And his parents are crying. And they're saying, Dr. McCullough, this vaccine was so horrible. He didn't need it anyway.
Right.
And it's true. Young people, even if a vaccine was safe and effective, they didn't need it. Young people didn't need it.
Right.
So many people's lives have been ruined by this process. Okay, let's zoom out and get to some
And I just want to point
solutions
out to folks, Dr. McCullough has troponin here that's often used to diagnose infarction or a heart attack, myocardial infarction, through a series of these tests to see if they go up. And then he also has here one of the more important markers of heart failure, which is this particular peptide. Which can be measured as an indication of heart failure. So anything else you wanted to add to that,
yeah,
Peter?
and you didn't circle the last one, galectin-3.
Oh, yes.
That's a marker of cardiac fibrosis. By the way, in each and every patient who's had serious vaccine injury, I measure troponin, BNP, and galectin-3. They're offered by LabCorp. They're very affordable. And
what about D-dimer? That's what I've been using as well.
Yes, I measure D-dimer, but D-dimer is a measure of this micro blood clotting.
Right, exactly.
So I actually have it on a single ticket where I order these 3 in D-dimer. Yeah.
Oh, great.
Okay.
That's a
If
great
you can
tip.
zoom out, Michael,
Yep,
this is,
happy
so
to.
you can see how useful this guide is going to be, and make
It's a
sure.
great guide. When did this come out?
This came out in the last few months.
Oh, wow. Okay.
And we worked so hard on it to
It's amazing.
Show. And
Incredible.
we've described the body systems that are affected, and just scroll down.
Yep.
I want to get to, importantly, the antibody measures and the measure. Keep going. Scroll down.
Yep. Oh,
Okay, here we go. So at the lower left is the use of the LabCorp quantitative antibody against the spike protein. This is done on what's called the Roche Alexis system, and this is the premier test. It's a LabCorp. You can self-order it. So if you go to labcorp.com, Labs on Demand, infectious diseases, COVID-19 antibody, and just click on it. It'll do this test for you. You pay $69 and just order it yourself. You don't need a doctor. This is so important because a lot of doctors don't want to go there with this problem.
Right.
And so this is telling people, and this is based on hundreds of publications, our review of this, and what I found in my practice. If it's less than 1,000 units per ml, it's very low risk past exposure.
Okay.
If you're in this category, you're honestly free and clear. And most people with the infection, they've had it once or twice, they're below this level. That's where my wife is, my co-author, John Leake.
Yes.
And some very fortunate vaccinated patients. So my mother-in-law took two Pfizer shots. She's 92.
Right.
She lives with us. This is back in 2021.
Right.
And she never even felt a sore arm. Nothing.
Wow.
Nothing at all. And she measured
amazing.
at 200 units per ml.
Oh.
200.
Now,
Now,
Peter, we're going to get into your base spike detoxification protocol. Have you seen these numbers drop?
Yes. Yes. And we've published that. They
That's
drop.
huge.
So you
That's
want to
huge.
see about a 20% drop in the antibodies. Remember, the antibodies lag the spike antigen by 6 to 9 months. So all you want to do is see the antibodies moving in the right direction. That means there's less spike stimulating those B cells and plasma cells, and the antibodies go down. But there's a paper by Barham and colleagues showing that the average person who's having long COVID syndrome is at 2,000, and the average patient with a vaccine syndrome is at 11,000.
Oh.
Okay.
Wow.
So today I had a man with multiple blood clots, relentless, and he's been unmeasurably high, over 25,000 now for a year and a half.
Wow.
So, and LabCorp tells us they can measure it up to 100,000, 70,000. They just have to truncate it because it takes time to keep doing the dilutions and then, converting it to a quantitative number. So they have to call it at 25,000. Don't try to order at Quest. Quest truncates it at like 2,500, and they're using something called the COBIS system, or don't send it to CPL. It's got to be LabCorp and the Roche Alexis system. And it's only $69, thank goodness. You can just order it yourself. Many of you are healthcare providers. You've been exposed to patients. I'll tell you my story. I was treating patients all through the pandemic. I had one documented case of COVID, and then I had 2 contextual cases. And I was at 2,300 myself.
Oh.
And my ears are ringing. I had tinnitus. I didn't feel so well. And I went on the spike detox, and it took about 9 months, and I dropped it to 900. And
Wow. Is that the retest interval, Peter? 6 to 9 months to repeat the blood test?
It's actually probably 9 to 12 months.
9 to 12 months to repeat the blood test.
You just can't measure it every 3 months. I've had patients do that. They get so frustrated. Okay, if we can get back to the guide.
Yeah, you bet.
So the antibody measurement's important because it does indicate exposure. Now, let me tell you, this is how important it is. If somebody has a serious problem like a blood clot, and their number is 200 or 300, I can tell you the blood clot is not due to the spike protein. It's probably due to a genetic factor or other factors. It's very important. Under 1,000 has a very strong negative predictive value based on all the peer-reviewed studies.
Okay.
Yeah.
So meaning if they have a low risk, they have a low number below 1,000 and blood clots, it's not due to the spike.
I mean, but that's how useful it is. Yeah. Go ahead and scroll down.
Sure.
Okay. Now here is the natural detoxification proposed, and we proposed this in 2023 after we had already worked with this through 2022. So this is it's going on 4 years now. Nattokinase, which is a natural proteolytic thrombolytic enzyme derived from the fermentation of soy or chickpeas. Bromelain, which is a family of enzymes, and by the way, it's also a prescription drug used topically. Bromelain is a family of proteolytic enzymes that is actually a natural anticoagulant derived from pineapple and the stems of pineapple. But bromelain actually prolongs the prothrombin time. So it is an anticoagulant. And then curcumin, derived from turmeric, and curcumin is a natural anti-inflammatory. And in meta-analysis, curcumin in human randomized trials reduced the risk of severe COVID. So it had anti-SARS-CoV-2 properties. And so these were combined into a single product. The wellness company has the Ultimate Spike Detox. And probably our greatest move on this was to massively increase the doses. So at 2 capsules twice a day, one is getting 8,000 fibrinolytic units of nattokinase. They're getting 500 milligrams of bromelain and 1,000 milligrams of curcumin. I commonly even double that to get it to even higher doses. And the big single greatest caveat is taking prescription blood thinners like Eliquis, like Xarelto, Pradaxa, or even warfarin. Now, you do that in my practice, but with a caveat that if there's bleeding, nosebleeds, bleeding while brushing teeth, or bleeding under the skin, we have to back off on the dose. We should stop these products before major dental work or surgery for at least 2 days.
2 days, yeah.
Yeah.
So, Peter, is it also you checking PT and INR as well?
No.
If you're taking an anticoagulant?
No, with the novel anticoagulants, those tests aren't reliable. Of course, in warfarin, we measure the INR, the International Normalized Ratio. But no additional blood tests is needed. It's really kind of a clinical caveat we just warn patients about. Now, I've treated several thousand patients with this protocol at this point in time. I've had one serious case of bleeding. One? And it was in a patient with occult liver disease, and he already had a prolonged prothrombin time due to liver disease. And so he came in with esophageal bleeding. We stopped the products, and he didn't need a transfusion, or it wasn't fatal. But I've had one serious case. So I think the reason why we're doing so well is we warn people about this. We're using natural products at medicinal levels.
Yeah, and Peter, I just want to underline something you said before, that there are no pharmaceuticals and no body proteins, or proteases rather, that will address the spike. Right.
So if you did something like, people have said, well, just boost the immune system. So that medical doctors have said, well, give Miraviroc, which is an HIV drug, or you would say give elderberry, or give something else. Boosting the immune system doesn't solve the problem, because we need the exogenous enzymes.
Yes. Yeah. And this is empty stomach?
Empty stomach.
Yep.
And with nattokinase, we actually even have pharmacodynamic data where it's actually been measured in the bloodstream. So for sure, natto gets in the bloodstream. Bromelin's partially absorbed. At best, maybe 40% gets in the bloodstream.
Yep.
Curcumin, notoriously difficult to get into the bloodstream. So it's either provided in liposomal format, or micronized, or with biopurine, or some other fenugreek, or some other absorptive. Now, I have to say, people said, well, if these enzymes work, do others work? We think that surreptase probably would work, but there are no preclinical or clinical data. None.
And lumbar kinase is the other one.
Lumbar kinase, I think it's going to be unlikely, but no data whatsoever. None.
Okay.
Not even a single in vitro study. At least with nattokinase and bromelain, you can physically see the spike protein dissolve in the preclinical studies. It literally dissolves.
Wow.
And nattokinase goes inside cells and outside cells, and doesn't hurt the cell, viability at all.
Right.
So we think nattokinase is the big horse.
Okay. And then, you have thousands of patients who have used this protocol successfully.
Now, let me say, I've had a handful of patients that we just can't seem to get this down, a handful. And we've gone on to advanced therapies. And one of the things we've done, particularly, had a patient with blood clots, turbo cancer, it was just horrible. And so we partnered with a company called Neo7 Bioscience, led by John Cantazzaro. And his company actually makes targeted peptides that are targeted to kind of bind with the spike protein, and then allow that complex to be cleared. And so it's experimental, and patients sign up for this and sign consent, what have you. So, that's a next level that we have.
So
I
you've
have
got a
patients,
plan B for people who
that,
need it.
right. I've had people try plasma exchange. It doesn't work because most of the spike is way out in the skin and the tissue. So you can't pull it off with
Oh,
dialysis. I've had
okay.
patients try ozone. That doesn't work because even if you could ozonate it in some way, it doesn't really seem to do anything. And I've had
Hmm.
patients come back with brachial or superficial blood clots because the spike protein is so thrombogenic. Once you remove
Hmm.
blood from the body and try to put it back in the body, watch
Right?
out. Same thing with
Huh.
stem cells. I've had patients with stem cells either cause blood clots in the arms or even cause heart failure, one
Hmm.
patient.
Hmm.
And it depends on the source of the stem cells, but the stem cells are probably, contaminated with spike protein.
Uh,
IVIG almost certainly is contaminated with spike protein. So,
really?
yeah. It's a combined product from thousands of
Right.
donors. So wouldn't advise those. There's so many things that people have tried. So I have patients that come to me and say, Dr. McCullough, I tried stem cells, plasma
Right.
exchange, IVIG, I've tried ozone, I've
Right.
tried, they keep going on and on. I said, well, have you done anything to get rid of the spike protein, like spike detox? No, I
Right.
haven't done that yet. It's like, that's the cause of the problem.
Okay.
I mean,
Wow.
fortunately, nattokinase, bromelain, curcumin are affordable supplements. If you want to
Yes.
buy them
Yeah.
separately and try
Sure.
to do your own, if you want to buy the combined product from the wellness company. At wellness
Hmm.
company, we specifically did not patent this. It's very important. No patents,
Hmm.
because there's too many people that need this, and there
Yes.
should be no restriction in the supply chain here.
Yes.
So it's
Yeah.
copyrighted in my name,
Sure.
for the idea, responsibility. I'm responsible
Yes.
for the idea, and
Right.
that was in 2023.
Wow.
But this is important, and naturopathic doctors can work and tweak this, and I'm sure some would say, add other enzymes. Now, there is one report by Dr. Shirasawa in
Hmm.
Japan. Now, this is a man about my age in his 60s who took the shots, 4 shots, and he had bilateral blood clots in his carotids that were throttling. They were actually
Oh.
just throttling there, and he thought
Oh.
little microclots were causing cognitive decline. And
Hmm.
Shirasawa, so alarmed with this kind of impending, stroke syndrome, he applied a dozen things at once, including
Oh.
nattokinase, bromelain, curcumin,
Hmm.
papain, seraptase, lumbrokinase, and the list goes on and on. He blasted them with a
Hmm.
high dose enzymatic blend.
Right.
And he demonstrated on serial virtual angioscopies that he cleared the blood clots. There was a spike in D dimer, then it went down, and the patient resolved his symptoms.
Oh, wow.
Yeah. So
Wow.
the idea is dissolve the spike protein,
Oh,
dissolve it or sweat it out of the body. Now, let
right.
me say parenthetically, besides sauna and sweating, the other non-pharmaceutical, non-supplement intervention that seems to work in almost every case, at least making people feel better, is
Right.
hyperbaric oxygen.
Oh, okay.
Yeah. So I routinely recommend that at least 20 sessions at 100% oxygen at 2 to 3 atmospheres. If you can go for 90
2 to
minutes,
3. Wow.
yeah, really crank it up. And at that point, that hyperoxygenation may change the conformation of the spike protein, and the
Hmm.
body may be able to clear it, although there's no
Interesting.
evidence to support that. It's just that every study is positive. It's hard not to,
Right.
recommend it.
Right.
There is another supplement of which there are emerging data, and that's N-acetylcysteine.
Hmm.
And at the wellness company, we have an ultra NAC, which is NAC with some other detoxifant like milk thistle and others
Okay.
products you recommend. There's a company in Europe that has augmented NAC that says that it's actually changed the nuclear magnetic resonance of N-acetylcysteine. That's still yet
Hmm.
to be demonstrated. They claim
Hmm.
they have seen clearance of spike fragments in the urine, but with no
Hmm.
published data for us to
Right.
analyze. But there's enough there, and I've seen enough people get better that I think adding
Yep.
N-acetylcysteine for sure to the spike detox. So the spike detox
Hmm.
is nattokinase, bromelain, curcumin. That would be
Right.
Wellness Company, Ultimate Spike Detox, and then N-acetylcysteine. The
Okay.
enzymes, make sure you take on an empty stomach. The other
Right.
products doesn't matter so much. At least a year or more. And then other products can be added. If there's myocarditis, I prescribe colchicine. That's another natural product, but
Hmm.
it's a prescription. Autoimmune, I prescribe hydroxychloroquine. If I think the SARS-CoV-2 infection is still in the body, with infective
Right.
symptoms,
Right.
night sweats, skin rashes, pulmonary findings, then I'll prescribe ivermectin. Prescribe it for about 90 days.
Okay. Okay. And I want to let folks know the Wellness Company has generously given our listeners a discount on their products. So you'll
Oh, good.
see a link in the chat on our watch page and in our Zoom link where you can get a discount on Dr. McCullough's products, both the Spike Detox and the NAC.
That's what Spike Detox is in the gold label.
Oh, there it is. Okay.
Yeah, it looks like that. And then the NAC is silver label.
Okay.
So those we think there's enough there. Now, when I publish this in copyright, I use the word base. Base
Yeah.
spike detoxification. That means
Right.
it's a base. You want to add other things to it.
Oh, okay. I was wondering.
Let me
Okay.
say one thing, Michael.
It's foundational.
I've learned with the infection and now
Right.
with long COVID and the vaccine, single remedies just don't work. This spike protein and virus is too complex. People said, well, just take some silver and you'll be better. It's like,
Right.
no,
Right.
single things don't work. We have to use multiple different products in combination. Fortunately, most of the products are natural.
Yeah, and it sounds like it's necessary because the main thing is to clear the spike. There are no endogenous proteases that do the job. On the pharmaceutical side, the prescription proteases are not getting the job done.
That's right. And people have even tried to revive the monoclonal antibodies, the anti-spike monoclonal antibodies, and there were 6 of them. A meritorious try, but the spike protein is deep into tissues now. And these enzymes do slowly percolate into tissues. And there probably is a body, biodistribution and a redistribution of the spike protein. But you can imagine it's going to take a long time.
Right. And I want to pick up on something you said earlier, Peter. This is a short video. Let me make sure. You mentioned the importance of circulation. I just want to show a short Beamer video before and after that might be helpful. Oops.
Where you go. So these syndromes is the.
Hold on.
But Michael, you almost pulled it off.
I did. I just I clicked the wrong button.
But these syndromes are the perfect application for the Beamer, as an example.
Yes.
Any of these products that can improve the microcirculation, the nice thing about it is you can only take so many supplements. And patients want to know what else they can do. So see if you can bring this up. But I anticipate it's going to really show. Yeah, there you go.
And this is before and after. This is, and just to give some context, this is a healthy 37-year-old male. No health issues, no health problems, athletic, fit. It was just stress impairing microvascular circulation. And you see on the left, that is an arteriole with a branching capillary and very stagnant blood. And then you see after 8 minutes, that's it, 8 minutes, the blood is just flying through that arteriole and that capillary just opened right up. So I appreciate what you said about the importance of whatever we can do to improve circulation. I think this would be an ideal adjunct to help the body with, as an adjunct to these other measures to detoxify.
For sure. For sure. So hopefully these principles we went over are helpful. This is a great vista. We've had 1 year of the new Trump RFK administration. They've made zero investment in researching the spike protein, zero investment in randomized trials.
Wow.
I don't think we're going to see it, to be honest with you. I think it's going to be left up to us empirically treating patients and doing the best we can publishing.
Wow. Amazing. Well, great, Peter. So how can folks get a hold of you? Just petermcculloughmd.com, Wellness
Right, so for
Company.
appointments, petermcculloughmd.com, Wellness Company, twc.health, and you should have a promo code. Hopefully, Michael, you've got it.
Gaeta, Gaeta.
Okay, so twc.health/GAETA. Great Italian promo code. And make sure you support McCullough Foundation, McCulloughFND.org. That supports all of our research, and myself, Nick Hosher, John Leake. We're commonly testifying. Nick and John will be on Capitol Hill in a few weeks testifying. We're representing you in fighting for medical freedom and to just, get past these terrible pandemic years and get
Yep.
us back on track. And make sure sign up for Focal Points. It's free. www.thefocalpoints.com. Get
Yeah.
your newsletter every day between 4 and 5 a.m. And then finally, America Out Loud Talk Radio, McCullough Report.
Yeah, that's excellent. Peter McCullough, you are a treasure. Thank you so much. I just appreciate all that you went through, from, being the attacks from what I call the medical mafia, just trying to silence you for just advocating for science, advocating for early treatment, questioning the safety of these experimental injections. We appreciate you very much.
Thank you.
Yeah, thank you, Peter. I know you've got patients to get to. So thank you for your time today. And we're going to carry on. I want to review some of what Peter covered with us and also give you access to the guide that he spoke about. So, okay, he has signed off. Let me just confirm that. Okay, yep. Yeah, just really, wow, that was remarkable. So just so appreciative of Peter taking the time out of his clinic. This is patient day for him, and that's why his first appearance on the show was recorded. We did a recorded interview for his first appearance on the show, just because today's patient day, and I'm sure he's walking into the treatment room any minute to do that. So sorry he wasn't able to answer questions. A lot of our guests have extra time where they can do that, but I just appreciate Peter's hour with us. And I will do my best to answer questions. I'm not Peter McCullough, but I will give a go on some of the questions that came in and give folks some next steps. So first of all, if folks did not get the code, it's twc.health/discount/Gaeta. And that is and that's in the chat and also on our watch page. So you can get a discount on all of his wellness company products. I was really appreciate I asked and they said, sure, we'll give your listeners a discount. So please take advantage of that. And I'm going to get into questions. Yes, can we have the guide? Yes, well, I'm going to give you I'll give you the guide here in the chat. Let me see. Here it is, publications. And let's see. Well, I'll give you the page where you'll find all of this. And this is the publication guide at the McCullough Foundation. So just click on that link. I'm also going to share it to the watch page. Folks who are watching the show today on the watch page, great to see you there. Thank you. And I will certainly pass along your comments to Peter the next time we speak. So yeah, Beamer therapy. We have a question here from Angela. Thanks, Angela. I'm just going to give you folks a link where you can learn more about Beamer therapy. It's known through the entire world except the U.S. as physical vascular therapy. And here's the code again for folks who asked. Also put it on the watch page. This will be a discount on all of the wellness company products. But I would strongly recommend folks get this home care medical device. I'm also going to put the Spike guide in here as well. So I'm just going to put this up on the screen. This is simply michaelgaeta.com/PEMF. And that is the page. I'll put that link also in the chat. And there it is. I'll also put this over on the watch page. And then I'll also put it up on the screen. So just to walk you through, this I think is going to be very important. And I've seen the same thing Peter has in practice, and I'm really glad he mentioned himself the Beamer as an intervention. And this is the only kind of science-based intervention with 65 studies in the literature using this exact device. So if you head over to michaelgaeta.com/PEMF, you'll see there's a weekly free class schedule. There is a 14-lesson free email course and education site. If you're a licensed health professional, we have, just for educational purposes and research purposes, a research compilation of 65 studies using this exact device. Other devices typically have 0 studies using that exact device. The most I've seen is 2. And this device has 25 years of research over, internationally, with 65 studies. So if you're a licensed health professional, there is a research compilation available for you. This explains what this is, and this is really the only device that focuses specifically on microcirculation, systemic circulation, as well as local blood flow. And you'll see an expanded version of the video I showed, a 2-minute and 20-second version of that is right there. And then purchase information is here as well, how to get one. And I would invite you, this coming Thursday, we have our monthly class, which is free, called Science and Solutions, Microcirculation and Human Health. And this is exactly what Peter is talking about, is that we have to get blood flow increased and optimized to clear the spike protein from the body. And that's just really important. This device was featured in Epic Times in this article, which is right there. We have some recorded trainings there right on this page. But it's quite remarkable, and I'm just kind of new to it, just 3 years in practice using this device, and as I like to say, became a better acupuncturist overnight. Because the patients noticed immediately something was different. They felt more relaxed, they felt more energized, they were sleeping better. It's quite remarkable. And again, this is used in thousands of hospitals and clinics around the world, including many hospitals treating inpatients in Hungary. It's just quite remarkable for optimizing circulation. And I have at least one functional medicine colleague is reporting 8 times better results with this device than with hyperbaric oxygen. And I think the reason for that is, and it's a lot cheaper as well than doing, long-term hyperbaric oxygen. This is designed to be used by the whole family, 8 minutes twice a day. Other devices, it's like an hour you have to lay on the mat. This is literally 8 minutes twice a day. So anyway, a lot of information is here. The video is here. How to get one is there. And there's lots of financing options and 0 interest credit cards and financing available. It's very affordable, especially when you compare it to other devices that have no research and cost 5 times more than this device. So it's kind of a very affordable option to do what Peter was talking about, which is you got to get that circulation improved. So michaelgaeta.com/PEMF for the details. And we have a class tomorrow night and on this Thursday, and basically every week. So please join us for those and lots of ongoing education for folks who have the device. All right, so that's that. I wanted to get back into answering more questions here because a lot came in, understandably. And again, my apologies. Peter had I'm so thankful he carved an hour out of his clinic day to do that. Dr. Schooler with the dryer balls. I love that. Outbreak of polio in South Korea. Well, I don't know. I haven't read about that. Oh, there it is. There it is. Thank you, Daria. Yeah, I'm not familiar with the outbreak of polio in South Korea. We do know that folks who have received the mRNA injections are more susceptible to getting like everything. And the neurological damage has been profound for many patients receiving the injections. Guillain-Barré syndrome and other syndromes. It's just been catastrophic. So, polio, it never went away. It was just renamed. We call it acute flaccid paralysis. We call it non-polio paralysis. We call it Guillain-Barré syndrome. We call it chronic inflammatory demyelinating polyneuritis. We call it a lot of different things. It just never went away because the cause, which of polio is really not a virus in most cases, but neurotoxicity, like Parkinson's is neurotoxicity. Polio, most cases, were neurotoxicity from DDT in the 50s, and that's why you had more polio cases in the summer. That's when kids were getting, just sprayed with clouds of DDT in the summer, and that's where we had the most polio cases. So my opinion is that the mRNA injections can contribute to any disease, any syndrome in anyone. It's really been horrifying how widespread the damage is. So for folks in the Zoom link, I just put the spike protein detox guide. For folks who are not, no problem. You'll see it right there in the McCullough Foundation publications. I'll put that again on the watch page. And then, so that's that. If folks want to, I'm happy to follow up with you. If you have questions about the Beamer device, just put your contact info. You can even send it privately to me directly in the Zoom page or in our watch page or what have you. So, so that's that. So you've got the guide. Richard, hey Richard, I've heard tests that can detect spike proteins. This can be done. Quantitatively, it seems improbable since it's not just in the blood but in the organs where it can hide. Is there any reason to get the quantity of spike? Also, what are the things were put in the COVID injections to watch out for sure? Lipid nanoparticles. Yeah, there's a lot of other things that were put in the injections. And apparently there were hot lots. Nick Holscher at McCullough Foundation has published about this or spoken about this, that there were certain lots that just were safer and others that were more dangerous. So there's no consistency. Perhaps by design, we've had here on the show the written testimony of a European nurse who was directed to give certain lots to dignitaries and politicians and elected representatives and others, which apparently were, saline perhaps, or just something innocuous, and others had much more spike. So that's a great question, Richard. Also, people taking tests that have had the COVID injection with shedding, is there any reason to take such a test? What would you look for? Yeah, I think Peter went over that, and I think this LabCorp antibody test seems to be, the best one we have at the moment. And he did say that there was a new test that they're validating, which should be available soon, which is direct measurement of spike. So, so I would say that and just what Peter had already said. Yeah. Yep. Dr. Schooler, shedding of live virus vaccines very well documented, 100%, for sure. And these were not really vaccines, but gene manipulation injections to force the body to produce a foreign protein, which is highly toxic. And I know there were, J&J and other, forms of the vaccines that were a little bit more conventional. But yeah. And Dr. Hinders, yes, tragic story with your husband. I'm so sorry. That was terrible. Epstein files, Carol, they're trying to damage the vagus nerve. How is this showing up in people? That's going to show up in a variety of ways, including anxiety, hypertension, insomnia, a lot of cognitive issues, as well as digestive problems. Yeah, for sure. Okay, so we've got Dr. Schooler has folks close to her who were murdered as well by the genocide jab, the poison death shot. The murder weapon, as Larry Palevsky called it on the show here some time ago, the pediatrician in New York. Yeah, oh boy, vagus nerve, yep. More pancreatitis, acute cases than ever before. Yeah, well, a lot of pancreatitis, is a few different causes. But I would assume, since the spike protein goes everywhere in every organ, that might be a possible cause, at least in some people, perhaps. So serrapeptidase, that's right. Yeah, that's a very different. That's the silkworm protein. These are different proteolytics. I use them all in practice. Nattokinase, lumbrikinase, and serrapeptidase, as well as trypsin and chymotrypsin. There's a range of proteolytics that can be used supplementally for various situations. Yeah. Yep. Okay. Oh, there you go. Carol talking about the nanotech. That's related to we talk about this, the nanotechnology at great length and in great detail, by the way, for folks who are not familiar in our COVID vaccinosis course. And that is something I think is one of our most important courses that we have put out. I taught this course and mostly taught by Pamela Richardson, who's a brilliant Canadian researcher and health freedom advocate. I'll put this in the chat. It's there now. I'll also put this on the watch page. That's a very important course, and she goes in great detail. We spent hours and hours and hours on graphene, and it's just remarkable what we now know about that. So you'll find that in the course. Highly recommended. Please use your Mondays with Michael discount code on our courses, MWM10. Again, MWM10 for all of our courses. So please take advantage of that. Okay, let's keep the questions going here. Yep. Sorry, yes, we've seen all these horror stories in the chat from folks who've been injured and killed by the genocide jab, working as designed. Yep, there's the bromelain. NAC, yeah, you can increase endogenous, or what the body produces of NAC, using milk thistle forte. Is a wonderful formula. Also there's some evidence of a ginkgo forte also being possibly helpful to help the body make more of its own. So I'll give you links to that. Peter mentioned milk thistle as an option, as an adjunct to his protocol, and I think that would be really helpful. So you'll see on that page the milk thistle forte, even one a day, which is what I take, is very helpful preventatively. And then with patients, I typically use 2 to 3, even up to 6 a day for therapeutic reasons, but typically 3 a day is pretty typical therapeutically, and then 1 a day for maintenance. Okay, yes, I'm with Dr. Schooler throwing the kitchen sink. I think that's wise. And by the way, we have Dr. Schooler here. She's going to be on the show very soon. I want to put up for folks. We have a pretty epic lineup of upcoming guests, including Dr. Schooler. I'm just going to put this up on the screen after I put it in the chat. I'm very delighted. We just had enormous interest in very amazing individuals interested in coming on the show to share their knowledge on our 2 subjects of natural health and health freedom. And I'm just going to put that on the screen for you. And this show, by the way, will be shareable from our watch page, or just share the watch page by the end of the day. So please take advantage of that. Share this show with Dr. McCullough widely. So just going to put this up on the screen. And we had Dr. McCullough today for his second appearance on the show. Dee Dee Hoover, who is the partner of the great Dr. Paul Thomas, who was just on the show 3 weeks ago. She's coming on the show to talk about children's mental health. And then we are honored to have Dr. Daria Schooler, who is here today, who is a physician, pharmacist, and neurosurgeon, will be on the show. And I'm just going to take a shot here and see if Dr. Schooler would like to just come on for a moment and say hello to folks. We'd love to say hi to you there, Daria.
Hi. Sorry, I didn't get my fancy suit on for everybody.
Oh, no
I
worry.
have my
No
Beamer
need.
sweatshirt on.
Oh, there you go. Well done.
Anyway, hi everybody. Yeah, thank you so much. I'm still trying to figure out what would be a fun thing to talk about. I don't know if you had a chance to look at those books I sent you, but I think the idea of comparing medieval natural remedies
Yes.
to Chinese medicine, because I
Right.
saw some similarities and overlap that one would not have expected
Yes.
so many centuries ago. And
Yes. It
yeah, even though
bleeds.
there's the Silk Road and all that, but I'm not
Yeah.
sure how that blossomed in two different places at
Yeah.
almost the same time.
That's right. Well, happy to explore topics that you're interested in, or part of your vast expertise that you want to share with people. But please tune in. That's just going to be in 2 weeks. We're going to be with Dr. Darius Schooler, again, physician, pharmacist, and neurosurgeon, who's going to be with us. So I look forward to that conversation, Daria. Thank you.
Thank you. I really appreciate it.
You bet. Yeah, thank you. And then back to our schedule page, just an epic lineup. Speaking of vaccine issues, we're going to have back on the show for the fourth time Dr. Brian Hooker, the Chief Scientific Officer at Children's Health Defense, will be with us in 3 weeks, right after Dr. Schooler. He is the author or co-author with Bobby Kennedy of one of my favorite books, Vax Unvax, Let the Science Speak. And make sure also you get Dr. Paul Thomas's new book, Vax Facts. It's a masterpiece. He did a great job. And one of the few books on vaccines written by a pediatrician he just shared this on the show a couple weeks ago, total patients seen, 100,000 children in his 30-year pediatric career before he was assaulted by the medical mafia and run out of town for practicing informed consent, which was the first thing we talked about. I was on his show. We recorded 2 episodes of his show last week where I'll be on his show. Those will be out very soon. And those are excellent conversations. Really recommend that to you. Then I'm super stoked. We have Dr. Edmund Kwan. He is a surgeon, specifically plastic surgeon, where I grew up in New York City, and the author of one of my favorite books called Let It Flow, on the importance of microvascular circulation. So he's like, well, we had a great conversation last week, and he said, well, I do plastic surgery, as for a living, basically, but my passion is microcirculation. So we're going to be doing a deep dive on that and the current state of modern medicine, which I also love to get into with Dr. Schooler at that as well. I know she has a lot to say about the current state of modern medicine. So anyway, we have that coming up. And then, but wait, there's more, as the commercial used to say. Following Dr. Kwan, we have the medical freedom advocate Laura Desmarais will be with us. Then from Down Under, Charles Coves, the attorney turned passion provocateur, will be with us. And then we have a kind of a sad but hopeful update from Scott Shara, whose daughter was murdered in a hospital. And he's going to give us the unfortunate update. He lost that lawsuit. But he's going to give us all the details of that and next steps on, and his new book, which has just come out. He's going to be telling us about that as well. Also about issues with the current medical system. Then we have Dr. Susan Downs coming to us from the Silicon Valley Health Institute in about 2 months. And then May 25th, Dr. Michael Priestman, one of my students, graduate of our functional medicine program, has done amazing work since he graduated in this whole area of wellness care. So we're going to be hearing from Dr. Michael Priestman just before my birthday, which is May 31st. He's going to be on May 25th. So looking forward. So I'm just an incredible schedule of guests this year, just an epic lineup. And also on our page, you'll see if you'd like to make a contribution to keep these shows going, you can, and a list of past guests with their contact info, with their websites and such are all here. And then at the bottom, you'll see selected shows right there. Just click on it, including there is Brian Hooker, Mickey Willis. We recorded an episode of the show where I interviewed Mickey from his studio in Austin, Texas, and just wonderful guests. So you'll see a whole ton of past shows from our watch page, which you can access right here. So that is that. And also, just by way of announcement, just wanted to invite all of you to join us for a very important course that's going on right now. And then I'm going to get back into your questions. Why We Can't Sleep, a framework for rest, longevity, and performance. We have class number 2 this evening with Dustin Strong. I taught the first class. It was recorded. It went really well. And then we have 3 classes with Dustin on rest, longevity, and performance, and the importance of sleep, and very leading edge science on sleep and how to optimize it. So all the classes are recorded. Please join us for the class tonight. I'll give you the link, and then 2 more weeks, all classes recorded. And so please join us for that. And this is right here. And I'll put this also on our watch page for why we can't sleep, and also how to sleep better is right there. All right, so that is that. And then we are going to, let's see, we have other questions here. Yep, you've got the discount code for Wellness Company. Monthly trainings are recorded. They are. So if you register, that'll get you into the system for that. Thoughts on MCAS? Yep, this is mast cell activation syndrome. I believe this is certainly part of the spikeopathy that we're seeing is immune dysregulation. I believe it's also certainly related to just the onslaught of environmental toxicity. I believe it is connected to spike, as you said, Nicole. I think that's really very clear because we're just seeing more of this. So I've treated several patients successfully with MCAS using natural functional medicine and Chinese medicine. Had very good results with that. Oh, thank you, Victoria. Wow, you're awesome. Thank you, Victoria. I'm going to put this on our watch page. The link to the LabCorp spike test is right there. Yep. Yeah, Carol, thank you for that mention of the gene modification. Really terrible. Anne-Marie, suggestions for receding gums. Yeah, this is a form of scurvy. Scurvy, collagen breakdown. And if you can improve collagen production, so bleeding gums is a form of scurvy, receding gums, leaky gut, varicose veins, spider veins, hemorrhoids, crepitus. There's so many forms of scurvy, which is a nutritional deficiency of vitamin P, as identified by Dr. Albert Szent-Györgyi in the 1930s. Pretty remarkable. So vitamin P, the best source of that, Anne-Marie, for those receding gums, is organic buckwheat. Organic buckwheat. So you can find that in your diet, and you can also find that in the supplements, Cyberta Plus, which I just put into the chat. And you chew 4 of those twice a day, and start with 2 to 4 months. Typically, I've seen improvements in those receding gums within 2 to 4 weeks. And it can help with a range of other issues. Like I said, I've seen countless cases of varicose veins, fading from the improved collagen surrounding those vessels. The vessels are less fragile. Folks who bruise easily, folks with elevated cardiac or irregular C-reactive protein. That formula is very helpful. It's from the 1930s. And particularly that one might be 1950, but it's been used for a long time for receding gums and similar. The herbal adjunct to that for improving circulation, Cyruta Plus does that as well as collagen formation. So think circulation, collagen formation is a 3-herb blend of gotu kola, ginkgo, and grapeseed extract called the gotu kola complex. And so that's an optional add-on if you want a stronger result or in less time, or if the Cyruta Plus alone is insufficient. Then I use the companion formula on the herbal side, which is the gotu kola, ginkgo leaf, and grapeseed combination, which is known as gotu kola complex. I typically use 3 a day therapeutically, 1 or 2 a day preventatively, and up to 6 a day with a tough case. That's just what I do in practice. I'm not, giving medical advice, just sharing stories from my clinic of, and those of you who haven't yet had a consult, or at least in the past year, I do recommend the annual checkup, natural functional medicine checkup, and you can schedule that. And about 80% of my practice is virtual through Zoom, kind of just like this. And then the other 20% roughly is folks who come into the clinic here in Boulder, Colorado. We've had folks fly in from all over, but most of my practice is virtual. So there's the link there on the patient's page where you can schedule just a simple Q&A call or a complete evaluation and care plan. All right, so there's the answer for the receding gums. I had just huge success with that. Really helpful. Black seed oil, that's great. Thank you, Daria. Best place to buy a Beamer mat. Yeah, I gave you the link previously, and also just give you the direct info. My colleague Cynthia in Texas she will walk you through the purchase process and make sure you get all of our training. We do a ton of training, onboarding, ongoing support with our group. It's very comprehensive, and we specialize in working with practitioners, but we have a ton of my patients are using the device at home as well. So there's all the purchase information, and that'll also give you access to our onboarding, training, ongoing education, ongoing support for that medical home care medical device. And yeah, and there's a testimony from Dr. School where she's used this in her clinic and her clinical practice as well with great results. So thank you for that. PK, hello PKACA, Picasa. Do you have suggestions for dry macular degeneration? I sure do. The Beamer would be very specific for that, for optimizing microvascular circulation in the eye. We've had countless case reports of folks with both dry and the more advanced wet, as well as cataracts, vision improvement, all kinds of things folks have reported over the last 28 years with this device. So it's a great eye thing. And then I'll recommend, just again, I'm not prescribing medical advice here, but just saying what I do in practice. I'll give you a couple. First thing will be that Cyruta Plus is a great vascular formula. And then there's an herb, which is a fruit, bilberry. And there's a particular formula of that, which is particularly potent, which is the bilberry forte. And I typically combine that with the Cyruta Plus with great effect. And even the gotu kola complex for improving vascular health in the eye, and the eye-specific nucleoprotein is very helpful for all things eye. So I'll give you a link to that as well. And this is very specific for eye issues only. But if there's an eye issue, I always use this formula, typically in conjunction with the bilberry, the Cyruta Plus, and there are other formulas based on presentation. All right, so that should really help. Yeah, I've had very, very consistent results with that. Again, not a guarantee, and then but just I've seen good results. Anne Marie, suggestion for protocol teenage boys to maximize their growth potential. Yeah, well, on the nutritional side, and you're welcome, Picasa. Maximize the growth potential. Yeah, there's a few things. One is is the diet, which is always the foundation. And for that macular degeneration, see what organic berries you can access where you live. And I would eat about a cup a day of whatever is organic that you can get access to. Any berry, a blueberry, raspberry, blackberry, whatever. Most of the research was done on blueberries, but really any berry. And then the bilberry is an example. That's a very super concentrated formula of the bilberry forte. But you can also for that. Oh yeah, we have plenty. Yeah, we have plenty of time for questions. After Peter's presentation, we could spend the next several shows just unpacking what he shared, which is so dense. And I think that's because he knew he had limited time and kind of gave us a massive download of wonderful information. So yeah, so we will get to that for sure. So first thing is the diet. The main thing is animal fats are essential for growth and development. So at least a dozen eggs organic per week, preferably over easy, like a runny yolk, is what I would, one thing of many in the diet, Anne Marie, for teenage boys to maximize their growth potential. The other thing is in the diet is just plenty of animal protein. So typically these teenage boys, my son is no longer a teenager; he's 21, but he'll typically consume about a pound of meat per day, organic, pastured, grass-fed, and he's very lean and very strong, and that complements his almost daily gym workouts. And he's gotten into golf, which is really fun. So plenty of organic, pastured animal foods, animal fats. So you have your grass-fed beef, bison, organic poultry, organic bacon and pork products, eggs. All of these things are very, very helpful. All the game meats, if folks are in, are like that, the venison and such. But that's a big part of it. Meat and eggs, just simple, is very important. So having that every day or at least 5 days a week would be important, and aiming for at least 100 grams of protein per day. Based on body weight, you want to be ideally between 2/3 and a gram of grams of protein per pound. So half a gram per pound would be a little light. Closer to 2/3 to 1 gram per pound would be better. That would be really helpful for that. And again, eggs are the perfect growth food. Now, therapeutically, there's one herb in particular which is very specific for mental or physical growth optimization, which is, put it that way, that I use. Again, I'm not being prescriptive. It's just that I've seen, countless kids in my practice over the last 36 years of practice that I just kind of figured out what works. So there's an herb, which is an Ayurvedic herb, which is used all the time for preconception, prenatal, postpartum, and throughout life for the child, that particularly when there are any developmental issues, and that is ashwagandha, Withania somnifera. We talk about it in our sleep course that's going on now because it improves sleep. That's the somnifera part, named after the Roman god of sleep, Somnus. So I would certainly recommend what I use in practice anyway is 2 a day therapeutically is all you need. And then what I take personally myself, just preventatively and for wellness as an adaptogen, is 1 a day. So it's a very low dose formula. But I use that all the time for kids with either mental or physical developmental optimization. So that's that. And then let's see. Okay, so there you go. Yeah, organic ashwagandha powder. There you go. So you want to be somewhere between 4 and 5 grams a day. That's what I use. One of those tablets is 4 grams, and 2 tablets would be 8 grams, which would be definitely a therapeutic dose. 4 grams more of a maintenance dose. That's what I take myself because it's one of the few herbs. The other one is Shizandra, Chinese medicine, Wu Wei Zi, which gives you energy, stamina, and endurance physically and mentally, but also improves sleep, calms the mind, and relieves anxiety. Shizandra does that. That's a Chinese herb. And ashwagandha does that, which is an Ayurvedic herb, which means horse smell or horse strength. Different translations of the word ashwagandha. But a very good herb. It's the best thing for raising DHEA when it's low. Much better than taking DHEA as a supplement, which I think is a terrible idea. It's much better to help the body make more of its own. All right, we have done we're going to get to Dr. Schooler's spike protein questions. I'm just going to first jump over to we have a lot of folks on our watch page. Thanks, folks, for being on our watch page. And we had a couple of questions there. So let's do that. Angela, hi, Angela. What are the symptoms people are showing if they are in the moderate to high levels? Well, it's hard to say because it can cause anything. But I will say most frequently, Angela, if you're talking about spike antibody as a proxy marker for spike levels, then the main categories, well, 3 main categories, it's kind of a triad of doom, is cardiovascular. So that can be anything from shortness of breath to heart failure to blood clots. It can be neurological, everything from brain fog to tremor and neuropathies. And then immune and I'm dumping autoimmune in that category as well, which will be just frequent sickness, impaired immunity, getting sick easily, readily, in a prolonged way, staying sick much longer than usual, autoimmune conditions. And by the way, if you'd like to, my humble opinion, this is the best self-study program, an interactive course on autoimmune disease. We've had this program for 11 years now, and it just keeps getting better. Just go to autoimmunememasteryprogram.com or the link that's in the chat and in our Zoom chat, autoimmunememasteryprogram.com. It's superb. We have 6 faculty and live interactive monthly classes. It's awesome. So that's the deal with that. Also, Dr. McCullough talked a lot about cardiovascular, that's his specialty is cardiology. We have a great course specifically on that called the Cardiovascular Mastery Program at cardiocourse.com, cardiocourse.com. So you will see that there as well. And this is our cardiovascular mastery program. And that is saying, yep, with our 6 faculty, our autoimmune mastery program with 7 faculty and live monthly interactive classes. So back to your question on that. Yeah, so those are some ideas of symptoms, but I've seen everything. I mean, just people are just broadly ill with a range of things if they've had the death shot, and so that's why, clearing that spike is important. Mary, hello, Mary. Non-COVID vaccinated may test by LabCorp CD19 antibody for shedding. Yes or no, Kelly Victory with your well. Okay, great. Yeah, so for sure, folks can certainly, because that's measuring antibodies to spike. And as Dr. McCullough pointed out, there's some evidence for spike shedding in epithelial tissue, includes the lungs and breath and sweat and other body fluids. And he indicated it would be much more mild, obviously, than folks who actually receive the gene manipulation injection. But it still would be, certainly appropriate to check. I'm going to check my next round of lab work. I'm going to add that in. GP suggests this touch on the rust region radio shown vaccine at 20 years, wonder about shedding. Yeah, I'm with you, Mary. I think it certainly can't hurt. I know there's a little bit of an expense involved. I think it's $69. But other than that, I don't think there's a downside to getting that LabCorp spike antibody test. Angela, hi Angela. Would Beamer therapy help while taking the detox protocol to circulate through the system? Absolutely, 100%. Because the Beamer, again, this is unique among any PEMF device, is a drainage and detoxification device as well, because it improves drainage out of the capillaries into the venules, but also optimizes lymphatic circulation, dramatically improves. And then the lymphatic system is our circulating immune system. It's also a circulating sanitation department, so to speak, if you want to call it that. So I'll just give you the data on that. Just as an example, you're seeing here, and this is what Dr. Otto Warburg talked about as necessary for optimizing cancer resistance, was getting the blood flow so quick that there would be oxygen left over in the venules, meaning the capillaries and the tissues, the cells were full of oxygen, so there was the cup runneth over, and we had extra oxygen in the venules returning to the heart, that there was measurable oxygen in the veins, which is a brilliant thing that Dr. Warburg talked about, several decades ago. But here's the Beamer compared to other devices, and you see just a dramatic 30% improvement in venular oxygen, certainly compared to other devices that did very little. And then you look here, the number of areas that receive oxygen is improved 20. This is in 8 minutes. Is just a very short treatment time. Other devices did little to nothing. This particular device, again, the only science-backed device where the research was done on that exact device, not just generic research on generic, PEMF signals. And then we get into venular flow. This is a great measurement of microcirculation. Yeah, all of these are, honestly. Venular oxygen utilization, number of blood cell perfused nodal points, venular flow. These are all excellent measures of microvascular circulation. And then finally, this relates to your question directly, is lymph flow. 32% improvement in lymph flow in 3 days, and even a day without treatment, which is this day 4. Every other device, there's no lasting effect. They just go right back to baseline. This device, the Beamer PEMF, the only device to have a lasting effect, even a day without treatment. So it's a durable effect. And my question is, if they kept the study going, would this just keep going up? I think it would on all of these measurements. So it's quite remarkable. And again, an entirely unique signal. It doesn't work because of the PEMF field. The PEMF field carries the signal like a passenger in a car. And that is the thing that improves the circulation. So a hearty yes to your question about that, Angela. The Beamer is a detox device in part by optimizing both blood and lymph drainage. Are the products available wholesale for practitioners? I don't know, Sharon. I don't think so. I think you can use our link to get a discount, but I would contact Wellness Company specifically on that. Hey, Sharon, would red light therapy help? I think it would, but also the near infrared, which is a little more specific for circulation. And there is a light therapy set. There's a lot of light therapy devices available. So this isn't the only one. But the Beamer has an add-on option of a light therapy set if you wanted to. But, there's a lot of different light therapy. But the answer is yes. A lot of yes to that. Glad you found it helpful today. I did too. I learned a lot today from Dr. McCullough. Not a big surprise there. He's brilliant. And so there's that. So red and near infrared, that's called the Beamer Restore light, but other devices as well. You want to get the combination of red and near infrared, which has the deepest penetration into the vascular layers with the near infrared. So you want both. Nothing is as good as the Beamer for improving circulation, microvascular circulation specifically, but the light therapy is an excellent adjunct. All right, so that's all the questions from our watch page, unless there's new ones. I'm going to jump back to our chat. And then we have Sabine. Oh, okay. Yep. Thanks, Sabine, for the comment. Yeah, Victoria, happy to. Yeah, I'll be happy to reach out to you. And then I'll also, please reference that page and the purchase info, but I'll follow up with you after our podcast today. So let me just cue that up. Okay, so that's that. And then Dr. Schooler, I think, had questions about spike protein. Dari, if you want to jump up there, please do.
Thank you. Yeah, I wrote them down because I tend to ramble.
Sure.
So when this all started back in January of 2020,
yes,
and we were presented with this COVID plague, okay, that was supposedly a virus.
Yes.
And yet within, I think it was less than a week, a genomic sequence was provided to start making vaccines.
Yes.
I don't know why my screen's froze, but I don't care.
Sure.
It's not my best face day.
All right.
So anyway, but when the messenger RNA injections were deployed, okay, obviously several things happened. One, immediate toxicity just from the administration, right? Because it's just loaded, jam-packed with poisons, which is now well documented. And then we have the extensive circulation, especially into fatty, lipid-rich tissues like the brain, the bone marrow, the ovaries, the testes, the liver, et cetera, et cetera.
Endocrine glands, organs.
Yeah, the glands. So then you have this absorption or incorporation of the spike protein lipid nanoparticles into the tissues. But then they open up, right? And they unpack. And then in the cytoplasm of the cell, the mRNA signal would start to hijack the ribosomes to start making spike protein. So the first hypothesis that was put out was that, well, the mRNA will disappear, but it didn't. Why? Because of reverse transcriptase, which grabbed those little genetic codes and turned them back into DNA that got incorporated into the nucleus of the cell.
Right.
So if there was just the temporary effect of the mRNA using the cellular machinery to produce spike protein, as Dr. McCullough mentioned, we would expect that to dissipate over time as those mRNA molecules were broken down and destroyed and eliminated. However, if in the cases where you're still measuring spike protein antibodies, and like he's saying, now we're going to have spike protein assay directly, which is going to be awesome. Then the big concern is, if they're still cranking out spike protein, that means their own cells are making it.
Yes.
And it's not the original exogenous administration of the mRNA.
That's right.
Into the body that was hijacked in your classic virus theory model of, making antigens, and expressing them on the cell surface. So my question is, how are we going to ever be sure, without engaging in lifelong treatment or therapy, of successfully completely eliminating the production of the spike protein? Will it happen as tissues regenerate, or will it be carried on in tissue regeneration? For example, all of our epithelial tissues regenerate. and
Yes.
turnover. And so if the genetic material from the dying cell is what's used to help with the regeneration of the next cell, is that next cell going to continue to produce spike protein? So the big question is, outside of objective testing and clinical assessment, how do we know when we can finally discontinue the therapeutic measures to counteract the spike protein load?
Yes.
Whether
Yeah.
we're making it ourselves or whether
Right.
it's just being leached out of our tissues where it got stored in those nanoparticles.
Yeah.
And
Great.
periodically spitting out more spike protein. So that was my question for him. And you can see how hard it is for me to ask a simple question because
Oh, no, it's okay. And, I wish he had more time because that's a
yeah,
great question. I love his perspective on it. My take on this is a couple of things. One is what you said, cell turnover. And so the short answer is we don't know. Nobody knows. We won't know. He's seen persistence 3.5 years later. So we don't know, the answer to this question. But some ideas I would have would be one is cell turnover. Most of the vital organs and tissues are replaced every 14 months. So what we can hope, bones about 7 years, brain, nerves much longer. My neurosurgeon, former brother-in-law, said about 25 years for nerve and nerve repair. But anyway, some period of time where we have enough turnover, and hopefully, we don't know, the new cells replacing the old cells will no longer continue to produce spike. So that's, again, all under the umbrella of we don't know. These are just some ideas and hopes, for sure hopes. Second thing is, in immunology, we know this is just a basic fact of immunology that any body protein, any body cell of the 30 to 38 trillion cells in the human body, that any of them that produce a foreign protein will be targeted by the immune system. And so this is an unsolvable problem with mRNA technology. And yes, we all wish that, more than a year ago, 13 months ago, that these mRNA injections would have been recalled and banned and discontinued, but we're still have them. But anyway, the reason that mRNA technology has an unsolvable problem is that they, without exception, to my knowledge, are forcing the body to produce foreign proteins.
yeah,
When those foreign proteins are expressed out of the cells in the vesicles or whatever, they are immediately targeted by the immune system as a threat. For example, if you have a cold or flu, and cold viruses, about 10% of them are coronaviruses. We've known about them for decades. That's what they call novel coronavirus from the lab. So there is also a possible. I'm trying to be hopeful here. Under the category of we don't know, I'm trying to provide the best possible outcomes. One is the spike producing cells die, the new ones don't. The second is that the body, through an autoimmune process, will eventually destroy all cells that produce foreign proteins. And they have hundreds of mRNA injections in the pipeline right now. Bobby stopped government funding, I think, of most of these projects. And Jay Bhattacharya, during the scamdemic, the plandemic, called for an immediate ban of all mRNA injections of any kind forever. So this hasn't happened yet. So obviously there's other forces at work that I'm not aware of. But they know how bad this stuff is. And as I've said here before on the show many times, I think, there's what Bobby wants to do, and then there's what Bobby is allowed to do. And I think those are not the same, right? And I think that's why some things are, moving slower than we would like. And then the whole glyphosate fiasco last week, which we'll get into next week. But so that's another hopeful thing. The other thing is, which is basically immune modulation, where the immune system over time, again, this is all my theories and nothing more, hopeful theories, is that the immune system over time gets better and better and better at clearing spike protein through other ways, the antibodies or other ways of that. I do agree with Peter. I think there's no drugs and no proteases in the body that address spike, but there are other mechanisms the body has to deal with it as best it can. Possibly that adaptation will improve over time so that there's less harm caused by this stuff. So those are just a few ideas. The short answer is nobody knows, right? It might be lifelong. I don't know. I think it's good that we have tools like Dr. McCullough's spike formula or similar that have been proven to reduce antibody levels. I'm glad he mentioned that. And yeah, I'm with Dr. Hinders. Nature wins, God wins. That's sort of the end of things is always life prevails. But I think these are some theories that I hope will. And what I go back to, Daria, is the Exxon Mobil Deepwater Horizon massive oil spill.
Mm-hmm.
Now, you could throw a tennis ball in any direction during that time when that happened many years ago, and you would hit with the tennis ball 10 marine biologists
Mm-hmm.
who confidently predicted the end of all life on Earth. We're dead, we're toast, it's over. The oil's going to kill everything. Once the oceans are dead, all life is dead. Life depends on the ocean. This is civilizational calamity. This is the end of humanity. And what happened? And none of them predicted this, by the way, that I was aware of. None of the marine biologists predicted this. The bacteria ate the oil. There was a particular strain of bacteria in small amounts in the Gulf of Mexico that had the ability to eat petroleum. And their numbers exploded exponentially, like it was almost a vertical line. They multiplied so fast because they had abundant food, which was petroleum, that they multiplied so fast. Within weeks, the bacteria ate the oil. And this is an example of, how there's stuff we don't know about. And there's, I believe, divine intervention, which has certainly acted in my life. Otherwise, I would have ended my own life many, many years ago when I was suffering from suicidal depression. In the natural, in the logical, in the rational, there was no reason why I didn't do the deed that day.
Mm-hmm.
And in the rational, in the natural, in the logical, life was going to end within months after the Deepwater Horizon oil spill in the Gulf of Mexico, and that oil spread all over the world and killed everything. So something happened that was beyond human comprehension or human intellect. And I kind of trust in that. I kind of summarized that in 2 words of God wins. Dr. Hinder said nature wins, life wins, whatever you want to say. That's always happened. Even facing, civilizational catastrophe from a massive oil spill, life worked it out in a way that all the experts did not predict. Right? You turned on the news and there was yet another marine biologist explaining how we were all going to die and when. Right? And it didn't happen. Life prevailed in a way that, nobody predicted.
Mhm.
So I always leave room for the miraculous. I always leave room for the divine. I always leave room for supernatural, if you would, or at least things that we don't mentally figure out. I always leave room for that. Particularly the bigger the challenge, the more life shows up in an amazing way and sorts us out. I believe the universe is very benevolent, and that's how we got here to begin with, right? There's no explanation at all anywhere in science to explain how we got here through random mutations and how inorganic matter became organic matter. It's impossible. It's never happened before. There's no explanation for the arisal or the appearance of hundreds of species of new life from random, non-life mutations. That's impossible. There's no statistical chance that that could ever be. So obviously, there's an intelligent design, and I trust in that, and it doesn't mean I don't have, a lot of clinical knowledge and experience and, treating many, many thousands of patients and, train 20,000 practitioners and all that. So I like to use my mind to help people, but I always leave room for the miraculous, for the divine, for stuff we can't figure out. And that oil spill was one of many examples of that, of how something we just mentally did not figure out happened. Nobody expected it. Nobody predicted it. No one even thought of it as a possibility that I'm aware of. And yet it happened. So anyway, that is, what I would say about that. All right, I think we've done all of the questions, and we're sort of we usually try to end around now after 2 hours. We're not going to Rogan this to 3 hours, although we have done that with Dr. Lee Merritt, who just knows so much, went for like 3.5 hours, 3 hours, 40 minutes. It was like an epic marathon show. And by the way, Dr. Merritt's going to be teaching a course for us next month on a very important health subject. So if you're not yet on our mailing list, please do so at michaelgaeta.com and make sure you find out about that. Also on our show page, michaelgaeta.com/MWM for Mondays with Michael, please sign up for the weekly email for this show. You just get one email a week on this show. And our main mailing list is typically one email a week where we share with you natural health information. So anyway, oh, great. Excellent. There you go. So Dr. Schoolers is good buds with Dr. Merritt. It's awesome. It would be an honor to have the other of this dynamic duo on the show very soon. So thanks, everybody. I'm going to play the piano for you just as a thank you for hanging in there for the whole show. And again, we can unpack Dr. McCullough's presentation for the next several weeks. But anyway, please take advantage. They were very generous at Wellness Company to give all of our listeners a discount with Gaeta. Gaeta is the Italian. And just use that link to get your discount. And that also helps to support the show as well if you're interested in that as a side benefit. But anyway, thanks everybody for being here. I will pass all of your love on to Dr. McCullough the next time we speak, and appreciation for this great man who literally, lost lost his entire academic career at Baylor and at Texas, Texas University, where the mafia went after him, and he was vice chair of his department uh, in university. I'm sorry, that was at let's see. Well, anyway, anyway, they went after him hard, and he's just been fearless. Like he doesn't care. He just keeps going and keeps telling the truth. It's quite remarkable. I think lesser men might have been crushed by the assault by his own profession that happened to him, which was horrible. And but he has persevered, and he's just, just so courageous in forging ahead with telling the truth about the about the murder weapon, the genocide jab, the poison death shot, and about, treatment. So he got attacked for saying we should be doing treatment. I mean, how crazy is that? But anyway, so really thankful for his presence today. He's testified so many times before Congress. We're just very thankful that he took an hour to be with us today. It was really appreciate that. So thanks, everybody. Blessings to you and yours. Make sure you see us in the coming weeks. And oh, wow, great story. Thank you, Dr. Score. So we will see you next week and in the coming weeks. Make sure you take advantage of all the things we talked about today, the solutions, the McCullough Spike Protocol, the Beamer home care medical device. There is, I put the links to Dr. McCullough's books. Thank you for, and there's an image of one of them in the Dr. McCullough's 3 books. That's the second one. Then there's Courage to Face COVID-19, and then the third book, which I put also on the in the chat. So thanks, everybody. Blessings to all. I'm going to play something for you. I'm not sure what, but I want to thank you for being with us today, and blessings to you and yours. Okay, see you next week. And tonight at our sleep class. Okay, very good. Oh, and oh, there he is. Somebody wants to say hi. Oh, yeah. Bentley has been very patiently waiting, and he wanted to say hello too. He's going to wave hello to everybody, and think he appreciates you being with us today as well. Okay, there you go, guy. Oh, wish. Okay, we have that, and that, and that. Okay, that should work. That should work. Okay. Well, here's one for Dr. McCullough. This is a song we used to do when I was a church organist, and it's called "Be Not Afraid." I haven't played it in a while, and I think that's something for all of us to remember: is to fear not, fear not. Okay. Well, thanks everybody. Great to be with you as always. And blessings to you and yours. And we will see you soon. Okay. Take care.
Thank you. Have a beautiful week, Doc.
You too.